Did you know that some very common habits during early pregnancy can actually harm your baby without you realizing it? Things like certain medications, poor nutrition, or skipping important supplements. And the truth is, many women make these mistakes in the first few weeks of pregnancy. So in this video, I will show you 7 early pregnancy mistakes you must avoid in order to protect yourself and your baby. Number one of them is self-medicating during pregnancy. That is taking medications without medical advice or without your doctor's prescription. That is a very expensive mistake during pregnancy because some drugs that are safe normally may not be safe during pregnancy. For example, certain painkillers, antibiotics, herbal mixture can affect the baby's development. A simple rule to follow is this: if you are pregnant, always ask your doctor or midwife before taking any medication. Even over-the-counter drugs should be used carefully if you must use it. The second mistake is not taking folic acid earlier enough. Folic acid is one of the most important vitamins in early pregnancy because it helps in the formation of the baby's brain and spinal cord. Without enough folic acid, the baby may develop neural tube defects such as spinal needle. Here's a simple way to understand it. Think of folic acid like the foundation of a house. If the foundation is weak, then the structure above it will become unstable. So ideally, folic acid should be started 3 months before pregnancy and continue through the first trimester. But if you didn't know you were pregnant, you just suddenly discovered it, please start taking it as soon as you confirm pregnancy. Number 3 is ignoring early antenatal care. Some women wait until they are 5 or 6 months old before visiting the hospital. But early antenatal care is very, very important. Doctors usually recommend first antenatal visit around 12 weeks or even earlier. During this visit, your healthcare provider check things like blood pressure, blood level, infections, and the baby's development process. These early checks help detect any problem before they become serious. Number 4 is poor nutrition. Pregnancy is a time when the body needs more nutrients, but many women still rely heavily on processed meals, sugary drinks, and low nutrient diets. A growing baby needs nutrients such as iron, calcium, protein, and vitamins. Think of your body like a garden growing a seed. Without enough nutrients, that seed cannot grow to maturity. So, healthy meals like vegetables, eggs, fruits, nuts, and whole grain would support both the mother and the baby. Number 5 is not taking iron supplements, that is your ferrous tablets. Iron deficiency anemia is very common during pregnancy. This is why doctors prescribe iron tablets in order to help the mother or your body produce hemoglobin, which carries oxygen to the blood. Without enough iron, the baby may receive less oxygen and nutrients. This can lead to fatigue, weakness, and complications during pregnancy. Iron supplements is usually started around second trimester or even earlier on as prescribed by the doctor. Another common mistake is chronic stress. Chronic stress. Pregnancy places extra demand on your body. So when you stress yourself so much, your stress level will become high and your body will release a stress hormone known as cortisol. Cortisol, whenever it's very high, it will affect your sleep quality, your immune system, and your overall pregnancy health. So, simple habits such as rest, relaxation, light walking or strolling can help your body and help support and maintain healthy pregnancy. Number 7 is keeping important preventive treatment. In many regions, pregnant women are usually given preventive treatment during antenatal care, such as malaria preventive medication, tetanus toxoid injection, normally known as TT injection, deworming tablets. This treatment protects both the mother and the baby from infections and complications. For example, tetanus vaccine helps prevent maternal and newborn tetanus, which can be a life-threatening situation. So it is very important to follow the antenatal schedule recommended by your healthcare provider. Now, let's quickly review the 7 early pregnancy mistakes every woman must avoid. Number one of them is first medicating without medical advice, not taking your folic acid in time, delaying antenatal care, poor nutrition, ignoring iron supplements, chronic stress and poor sleep, skipping preventive treatment. Avoiding these mistakes can greatly improve the health of both mother and baby. Now, pregnancy is a beautiful journey. You can attest to that. But it requires care, knowledge, and proper medical guidance. Always follow your doctor's or midwife's advice before taking any medication or supplements. If you found this video helpful, please subscribe to Ask Curiosity TV. Like this video, turn on the bell notification icon, and subscribe. Please make sure you're subscribed. And I would love to hear from you. What was your first sign? What was the first sign that made you discover that you're pregnant? Let us know in the comment section so that all of us can connect together.